Hello, my name is Danielle Miller. I'm a registered nurse that works on a medical telemetry floor that specializes in peritoneal dialysis. I am also an RN to BSN student at Millersville University. For this conference, I chose to use a poster that displays the telehealth for peritoneal dialysis. In 2018, kidney failure that required a transplant or dialysis affected approximately 785,883 people in the United States. A major concern of patients on peritoneal dialysis is not having oversight by nurses and doctors. Dialysis removes waste, salt, and water from a person's blood. There are two types of dialysis: peritoneal dialysis and hemodialysis. After reviewing this poster, the learner will be able to 1. Identify the benefits of a telehealth process for peritoneal dialysis patients, and 2. Review the limitations to using telehealth for peritoneal dialysis patients. Through this conceptual concept and a thorough literature search on this topic, the purpose of this poster is to describe how beneficial telehealth could be for PD patients. To identify a clinical need, I used a PICO question. The population are patients with kidney failure that require dialysis. The intervention is peritoneal dialysis. The comparison is the support from the telehealth technology versus traditional support. And the outcome will be to increase the patient's continuity of care, confidence, and independence. Peritoneal dialysis gives a person independence while providing a dialysis treatment at home, either throughout the day or at night when they sleep. Peritoneal dialysis is the cheaper treatment when compared to hemodialysis, yet many patients steer away from opting for peritoneal dialysis instead of hemo because of the lack of doctor and nurse oversight. Some benefits of telehealth for peritoneal dialysis include increased continuity of care, quick machine troubleshooting, increased patient independence, and a quick response time of the on-call nurses and doctors, as well as accurate data recording. Some examples of data recording that telehealth would be able to provide would be the measurements of vital signs, which include blood pressure recordings, your heart rate, temperature, and weights, as well as the documentation of catheter flows, machine alarms, and ultrafiltration volumes. Without telehealth, a patient would have to log these records and provide them to their doctor at their next visit. By providing telehealth services for peritoneal dialysis patients, we can help eliminate the fear of not having the doctor and nurse oversight, increase a patient's independence, and increase their compliance and satisfaction. Telehealth will ultimately increase the continuity of care and allow doctors and nurses to attend to patients that cannot access telehealth. The literature search showed that the PICO question is supported with the use of telehealth. Challenges and limitations do exist when introducing a new advancement. Through research, pilot studies, and evaluations, the challenges and limitations can be addressed. Some barriers include financial incentives needed to encourage doctors to promote more home dialysis, initial startup costs, training patients and staff on new technology, internet lag time, developing user-friendly platforms, and balancing inpatient and virtual inpatients with high comorbidities. Thank you for allowing me to present this poster.